what are the symptoms of low copper levels, and what foods give you enough copper, and do you even need to worry about a copper deficiency? Guys, I'm going to tell you this and more, and specifically watch to the end, because I'm going to tell you another supplement that if you're taking this other supplement in too much amounts, it can actually cause a copper deficiency. Yeah, so stick around. All right, so first of all, you need to understand that copper deficiency actually is pretty rare, okay? It's rare, it's not common. Yes, it happens. There are acquired causes of copper deficiency. I'm going to tell you what those are. There are some genetic causes. There is at least one genetic cause, one off the top of my mind, Menkes disease, that can cause a copper deficiency that is genetic, like an inborn error of metabolism, copper metabolism. But understand that copper deficiency is rare. But with that said, it does happen. Again, I'll tell you the risk factors. Let's first start by talking about the symptoms, all right? Let's start with the hair, okay? Because copper deficiency is actually characterized by sort of fragile and abnormally formed hair, which I think is super interesting, and I'll explain why that happens later on. But it's not just the hair, right? It's also the pigment of the skin. People can actually experience depigmentation, lessening of the pigment in their skin. I'll explain why that happens too. But there's also things like muscle weakness. You can have like neurological abnormalities. There can be swelling, swelling of the spleen, swelling of the liver, even things like osteoporosis. And I know those sound super random, and I think oftentimes with like vitamin, mineral deficiencies, the symptoms can be random or seem that way, but I have an explanation for it, so I'll tell you. But also, just to like drill down a little bit on the neurological problem. So what can happen? Things like problems with your gait can happen if you have a copper deficiency. Numbness, tingling, cognitive deficits, like the way that you think. And interestingly enough, copper deficiency symptoms in some ways, like the cognitive deficits, can actually mimic what people with a B12 deficiency can have. I have a video on the signs and symptoms of low vitamin B12, so I'll make sure I link that here. It's important. But there's other things. You can get an anemia, low blood counts. You can get like low platelets as a result of low copper levels. And of course, you're going to have like blood levels that reflect having low copper, right? Like a low plasma copper, ceruloplasmin, et cetera, like some techie stuff, all right? So those are some of the symptoms: hair, skin, liver, swelling, neurologic, blah, 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 like all over the place. Osteoporosis, I know, who would have thunk it? So in terms of why, it's because there are a number of really important enzymes in our body that use copper to work. And you're probably like, enzyme, what's that? Enzyme, I think of enzymes as like little engines. Enzymes are like catalysts. Enzymes like make things work. Enzymes are like the little guys in your body that go around saying, all right, we need a little ATP over here. We need a little energy. We need a little of this. And they get processes going. So many enzymes in our body use copper. So if you don't have enough copper in your body, these enzymes are not going to work to then make other things work, okay? So as an example, you may not have like antioxidant defense the way you normally would if you had enough copper. Why? Because of some of the enzymes involved in that. You may have issues with neurotransmitters. Remember I talked about like the cognitive and like the brain and the neuro stuff, okay? So there you go. There's also issues with enzymes that deal with collagen cross-linking and bone formation. Remember I said you can get osteoporosis? There's also problems with electron transport, thrombosis. Oh, and then tyrosinase. That is an enzyme that uses copper that deals with melanin production. So remember when I said that one of the problems with low copper can be depigmentation. It can be because of this enzyme not working well because you don't have enough copper to make it work well. See what I'm saying? This is why I became a doctor, y'all. I love science. So freaking fascinating. So like everything, it's like the hip bone's connected to the arm bone's connected to the leg bone. It's all connected. All right. Okay. So let's talk about the diet. And once again, I'm not here to make you think you have a copper deficiency. I told you it is rare, but just know. All right. So foods that can have copper, By the way, it's a lot of foods. Thank goodness for that. About 60% of dietary copper in the U.S. in the Western diet, comes from like vegetable products, veggies, also grains, pulses, which are things like legumes, beans, etc. We also get it from meat, fish, poultry, and then the highest content of copper is found in liver. So I don't know if you eat liver, but there you be. There's copper in a lot of things. Okay, just keep that in mind. All right. Oh, I should also mention that absorption of copper may be impaired by dietary iron, zinc, or ascorbic acid. Well, there's a little note that I wanted to let you. So we've talked about that kind of stuff. I keep saying it's rare, 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 but it happens. So who does it happen to? Who gets copper deficiencies? Well, these are the people who are at higher risk than maybe other people, okay? Those who have had like some sort of surgery on their stomach, their intestines, so gastric bypass or some other gastric type of stomach or gastric type of surgery or things like that, foregut surgery, gastrectomy, gastric bypass, you name it, and plenty of others that can be involved in that. Those folks can actually be at risk for a copper deficiency. Not just that, preterm infants that have been given a certain type of diet could be at risk for it, okay? People with chronic diarrhea or other malabsorptive conditions, things like celiac disease, when you don't absorb things the way you should in your gut, you are potentially at risk for a copper deficiency. People who are on dialysis. Okay, so here we are now with the vitamin, or it's not really a vitamin, but like the substance that I was telling you that if you take too much of it, you could put yourself at risk for copper deficiency. You ready for it? It's zinc. I know. Huge, right? You guys really should know this because people are now trying to self-medicate and take all this stuff and take all the things because they self-diagnose, which, by the way, I never, ever, ever advocate. This is why I'm always cautious when I talk to you guys. Don't go around diagnosing yourself or assuming you have a copper deficiency or a zinc deficiency or whatever. Let me tell you about zinc, okay? If you take too much zinc, and there's many different ways you can take it, many different forms, but if you get too much zinc in your body, it actually can cause copper deficiency because copper and zinc are competitively absorbed from the jejunum, okay? Meaning they compete, all right? So basically, if you take too much zinc, it can cause low copper levels. And that could be even heightened, the risk of that, if that person also has like a history of gastric bypass or some of the other risk factors I mentioned, all right? Not good. So if you're taking lots of zinc, prolonged use of zinc supplements, whatever the case, you can actually be causing yourself a copper deficiency. Please, please, please understand. And this is also why please don't go around diagnosing yourself or just taking things without discussing with your doctor, because you can actually do more harm than good. I also say too, and I say this with almost every video I do of like supplements and vitamins and minerals and stuff like that, many of these supplements, many things are not regulated by the FDA that we get over the counter, okay? So you may be sort of getting an unregulated substance. You may not know exactly what's in it, the amounts, etc. Before you diagnose yourself, don't diagnose yourself. Just go to your doctor and say, look, I read about this or I heard about this. I'm concerned about this. Have a conversation with your doctor. But in terms of copper deficiency, I think those are important things to know, but understand, again, it's rare. If you think you may be at risk, please talk to your doctor about it. And remember, the hair stuff, the pigment stuff, it happens. It is real. But it is not the most common thing. So that's why I say don't do this on your own. You talk to your doctor. I want you to tell me, was this helpful? What do you have a copper deficiency? Let me know. Issues with copper, write in the comments. Please share this video with anyone else who may benefit from it. Leave a comment. I'm Dr. Jen Caudle. It's good to see you, practicing family physician. Please subscribe to my channel on YouTube. Click the little bell for updates. I'm on Facebook, please like and follow my page. I'm on TikTok, WhatsApp, Instagram, LinkedIn, you name it. Please follow me at Dr. Jen Caudle. Go to my website, www.drjencaudle.com, to sign up for my free health newsletter. Guys, I love you. Bye.